Agile methodologies, originally developed within software development, have progressively reshaped organizational strategy across multiple sectors. Their core principles, stakeholder collaboration, responsiveness to change, prioritization of human interaction, and emphasis on actionable outcomes, offer a structured yet adaptable framework for nonprofit strategic planning. In environments characterized by volatility, political instability, and constrained resources, these principles support mission continuity while enabling operational flexibility. Nonprofit organizations increasingly operate under rapid socio-economic shifts and complex governance conditions. Traditional strategic planning models, often linear and procedurally rigid, assume relative stability and predictability. Such approaches struggle to accommodate emergent crises, funding disruptions, or evolving community needs. Agile introduces an alternative logic grounded in iterative cycles, adaptive learning, and sustained stakeholder engagement. The intellectual foundation of Agile departs from process-heavy managerial frameworks. Rather than privileging strict adherence to predetermined plans, Agile emphasizes flexibility, collaboration, and responsiveness. For mission-driven institutions facing shifting donor priorities and regulatory adjustments, this orientation reflects operational reality. Strategic recalibration becomes not a failure of planning, but a structured component of implementation. At the core of Agile is a rebalancing of priorities. Ongoing stakeholder collaboration is valued over prolonged contract negotiation. In the nonprofit context, this translates into continuous consultation with beneficiaries, partners, and community leaders rather than reliance on extended preliminary planning phases. When feedback mechanisms are embedded within strategic cycles, programs remain aligned with evolving needs and reduce the risk of technically compliant, yet socially misaligned interventions. Agile further prioritizes responsiveness to change over rigid adherence to initial strategies. In volatile contexts, inflexible commitment to predefined plans may undermine impact. Organizations responding to public health emergencies, political instability, or sudden funding constraints benefit from the capacity to revise operational approaches without compromising core mission objectives. Iterative planning cycles preserve strategic coherence while enabling recalibration. Another central principle places individuals and interactions above processes and tools. In resource-constrained environments, strong communication and collaborative team dynamics often exert greater influence on outcomes than complex technological systems or bureaucratic structures. Emphasizing interpersonal coordination strengthens institutional capacity and supports adaptive decision-making. Systems and tools remain important, but they function within a human-centered strategic framework. Agile also redefines the relationship between action and documentation. Accountability remains fundamental in the nonprofit sector. However, excessive procedural formalism can restrict responsiveness. Prioritizing measurable outcomes and timely service delivery sustains operational momentum, particularly where administrative capacity is limited. The objective is not to reduce accountability, but to ensure that reporting mechanisms reinforce learning and impact rather than obstruct them. Practical illustrations demonstrate how these principles operate across contexts. In community development initiatives, continuous local feedback enables real-time program adaptation, enhancing relevance and sustainability. During the COVID-19 pandemic, many organizations revised strategies rapidly, shifting to remote delivery models or mobilizing volunteer networks to maintain essential services. In disaster relief operations, iterative reassessment allows interventions to evolve as conditions change, strengthening coordination and risk management. Despite these advantages, integrating Agile into nonprofit strategy generates institutional tension. Donor-driven accountability structures frequently require predefined outputs and linear reporting schedules, limiting organizational flexibility. Balancing agility with formal compliance demands deliberate governance design and negotiated funding arrangements that permit structured adaptation. Participatory engagement, central to Agile philosophy, does not automatically guarantee inclusivity. Effective collaboration requires attention to representation, equity, and power dynamics. Without safeguards, consultation risks becoming symbolic rather than substantive. Embedding participatory mechanisms within governance structures ensures that community voices meaningfully shape strategic direction. A further challenge concerns balancing adaptability with institutional stability. While agility enhances responsiveness, long-term mission fulfillment requires continuity and organizational memory. Iterative cycles must therefore operate within a stable normative framework that preserves identity and core objectives. Agility functions most effectively when anchored in clearly articulated mission commitments. Agile principles represent more than a managerial technique. They constitute a strategic orientation toward uncertainty. By emphasizing collaboration, adaptability, human-centered coordination, and action-oriented planning, nonprofit organizations enhance resilience and strengthen stakeholder trust. Iterative methodologies reduce large-scale failure risk through incremental correction, while leaders remain attentive to governance, accountability, and equity in implementation. For scholars, integrating Agile into nonprofit strategy expands inquiry into the relationship between iterative planning, governance regimes, and social equity. For practitioners, Agile provides a disciplined yet flexible pathway for navigating dynamic environments while sustaining mission integrity. Adopting agility is therefore not merely operational refinement, but a strategic commitment to durable and responsible social impact.